2 billion. That's the number of human beings alive right now, as you watch this video, as you breathe, as you believe that every thought that passes through your head is entirely your own, with an organism inside their skull that wasn't invited, can't be expelled, and is actively modifying the neural architecture of its host. 2 billion. Twice the combined population of the United States, all of Europe, and Brazil. 1 in 3 humans on the planet. And the overwhelming majority feel absolutely nothing. No pain. No symptoms. No sign that something inside them has decided, with an elegance that takes decades to understand, who they will be. It's called Toxoplasma gondii. And it doesn't attack the stomach. It doesn't inflame the lungs. It doesn't show up in routine blood tests. It crosses the blood-brain barrier, one of the most sophisticated defenses biology has ever built, specifically designed to prevent external organisms from accessing brain tissue, and settles in the prefrontal cortex and amygdala, specifically in the regions responsible for judgment, impulse control, threat perception, and decision-making under risk. Then it starts working. Not to survive. To reprogram. Because Toxoplasma gondii doesn't just want to live inside you. It needs you to behave in a specific way to complete the biological cycle that makes it exist. And the discovery that science took 30 years to accept is this: it succeeds. What the data shows about what it does to your personality, your risk perception, and your response to loss situations will permanently change how you understand every choice you've ever made in life, but the exact mechanism by which it does this is biologically impossible to detect without a specific serological test that 90% of doctors never order, and which, even when ordered, rarely leads to any intervention. In 2012, neuroscientist Emil Rekansky, of the Slovak Academy of Sciences, published the data that no journal wanted to touch. Participants infected with Toxoplasma gondii were 2.6 times more likely to make extremely risky financial decisions in simulated loss situations, and, when questioned about their own risk perception, they rated their responses as perfectly rational, without awareness of the bias. Without access to the difference. The alteration was happening at a level below what introspection can achieve. Rekansky paused the publication for 18 months. Not for lack of evidence. For an excess of it. And because there was an implication that he didn't know how to write in an academic paper without sounding like science fiction, if the parasite can alter risk assessment systematically and imperceptibly, then a measurable portion of human decisions that we call free may not be free at all. Now let's go back to the beginning, because to understand what Toxoplasma does to humans, you first need to understand what it does to rats, and why this is, perhaps, the most disturbing example of behavioral manipulation that biology has on record. Jaroslav Flegr wasn't a psychiatrist. He was an evolutionary biologist at Charles University in Prague. In 1990, in his early 30s, he began to notice a pattern in himself that he couldn't explain. He was crossing streets without checking traffic. He ignored deadlines with real consequences. He made financial decisions that, upon later analysis, were indefensible. There was a kind of dulling in his perception of consequence, as if the alarm signal that warns the brain of imminent danger was operating at a reduced volume. Flegr tested himself for Toxoplasma gondii, positive. He spent the next 22 years documenting what this meant, not in himself, but in thousands of people around the world, and what he found was enough for more cautious colleagues to describe him, in private conversations, as a scientist who had found something that science wasn't yet prepared to process. The natural cycle of Toxoplasma gondii is elegant in its cruelty. The parasite only reproduces sexually inside the intestines of felines, domestic cats, lions, jaguars, any feline. There it produces oocysts, encapsulated microscopic structures that come out in the feces and contaminate the soil and water. Rodents ingest these oocysts. The parasite migrates to the rodent's brain. And then begins the phase that made Flegr stop in the middle of an article and stare at the wall for 20 minutes. Rats infected with Toxoplasma gondii lose their fear of cats. Not the fear in a generic way, they specifically lose the aversion response to the odor of felines, which is a reflex inscribed in the neural architecture of rodents for millions of years of evolution. But in infected animals, this reflex not only diminishes. In studies from the University of California at Berkeley published in 2011 in PLOS 1, researchers discovered that rats with Toxoplasma gondii active in the central nervous system not only did not flee from the smell of cat urine, they were attracted to it. The odor that should have activated escape circuits instead activated approach circuits. The predator became bait, the rodent walked toward death with the biochemistry of its own brain pointing the way. The mechanism was identified a decade later. Toxoplasma gondii forms cysts in specific neurons and stimulates the localized production of dopamine, the central neurotransmitter of the reward circuit. In brain regions that should process threat as threat, the parasite converts the danger signal into something chemically indistinguishable from pleasure. The rodent is not defective. It is being piloted. The question that Flegler spent 2 decades answering is unsettling in its simplicity. If Toxoplasma gondii can reprogram the behavior of a mammal with a nervous system analogous to humans, with enough precision to alter a specific survival reflex without destroying the animal's other cognitive functions, what does it do inside the human skull? The answer begins with Teresa Hodna. 28 years old, an administrative assistant in Prague, with no relevant psychiatric history. In 2002, she participated in a longitudinal study by Flegler as a control, that is, presumably uninfected. The serological test revealed the opposite, a high titer of IgG antibodies to Toxoplasma gondii, indicating a chronic infection established for at least 3 years. Teresa didn't know. She had never been ill. She had never had symptoms, but there was one thing she mentioned in the initial interview that Flegler marked with an asterisk in his notebooks. She described herself as less anxious than she should be, in situations that her coworkers found terrifying. Across 32 studies published between 1994 and 2019, Flegler and colleagues in 8 countries documented a consistent and replicable pattern. Men with active Toxoplasma gondii show measurable elevations in distrust scales, reduced social conformity, increased risk-taking tendencies, and, in cases of long-standing infection, traits consistent with the schizotypal personality spectrum. Infected women exhibit the opposite pattern: increased extroversion, greater social conformity, reduced risk perception, as if the same parasite were running different strategies depending on the host's biochemistry. This is not a metaphor. In a 2013 study published in the Journal of Experimental Biology, researchers measured testosterone levels in infected and uninfected participants. Men with T. gondii had serum testosterone concentrations on average 12% higher than controls of the same age and health history. 12%. Enough to produce measurable behavioral differences in contexts of social competition, defensive aggression, and risk-taking behavior. Toxoplasma gondii is not causing a disease. It is calibrating a system. And then we come to the numbers that Flegler tried to publish 3 times before finding a journal willing to print them. In 2002, a study of 146 traffic accident victims at Prague University Hospital and 446 healthy controls revealed that drivers infected with Toxoplasma gondii were 2.65 times more likely to have been responsible for the accident. Not passive victims, but the determining cause. The research was replicated in 2009 in Mexico with a sample of 653 participants, a relative risk of 1.91. In 2015, a Turkish study with data from 185 hospitals found a correlation between regional prevalence of T. gondii and local rate of fatal accidents. What epidemiology was describing, with the coldness of its confidence intervals and p-values below 0.001, was this: the presence of Toxoplasma gondii in the central nervous system of adult humans is associated with a consistent and statistically significant reduction in the ability to assess real risk in real time. That it's not impulsivity. It's signal dulling. The difference between a brain that breaks and a brain that doesn't break in time can be, literally, a parasite. And the transmission route that carries all this into your skull is so banal that you'll want to pause the video now. Undercooked meat, especially pork and lamb. Untreated water. Insufficiently washed vegetables. Contact with sand or soil contaminated by feline feces. You don't need international travel. You don't need risky behavior, you need a rare barbecue on a Sunday afternoon. You need a cat litter box in an apartment with an open window. You need nothing extraordinary, because Toxoplasma gondii doesn't specialize in extraordinary moments. It specializes in routine. In 1953, E. Fuller Torrey was a medical student at Cornell University when he first read that Toxoplasma gondii had been detected in brain tissue of schizophrenic patients at autopsy. He kept the information. 40 years later, he was one of the most respected psychiatrists in the United States, director of research at the Stanley Medical Research Institute, and had spent 4 decades revisiting that data. What Torrey documented, in collaboration with Robert Yokin of Johns Hopkins University, changed the way a growing minority of psychiatrists think about severe mental illness. In a 2007 meta-analysis published in the Schizophrenia Bulletin, Torrey and Yokin reviewed 38 independent studies and found that patients with schizophrenia had a consistently higher prevalence of antibodies to Toxoplasma gondii than healthy controls, with an average odds ratio of 2.73. In other words, people with schizophrenia are almost 3 times more likely to show serological evidence of T. gondii infection than people without the diagnosis. Torrey was careful in writing the conclusions. Correlation is not causation. The presence of the parasite may be a consequence, not a cause, of the immunological vulnerability that accompanies schizophrenia, but the proposed mechanism is biologically plausible and frighteningly specific. T. gondii stimulates dopamine production and alters arachidonic acid regulation in astrocytes, exactly the same dysregulation profile found in post-mortem analyses of brain tissue from patients with untreated schizophrenia. The parasite is not causing the disease. But it may be, in genetically predisposed individuals, pushing an already unstable system beyond the breaking point. And here is where the narrative changes direction, because the most disturbing part of this story is not what Toxoplasma gondii does. It's what happened when someone tried to do something about it. In 1960, when congenital Toxoplasma gondii infections began to be documented frequently enough to require a medical response, the scientific community identified 2 compounds capable of suppressing the active proliferation of the parasite, pyrimethamine and sulfadiazine. Together, they formed a protocol that is still the standard treatment for acute toxoplasmosis in 2024. The problem is that they don't kill the cysts. Toxoplasma gondii, once established in the central nervous system, form structures called bradyzoites, thick-walled cysts, metabolically slow, virtually invisible to the immune system, and completely resistant to any pharmacological agent approved for human use. Pyrimethamine eliminates the parasites in the active phase. The cysts remain. And when the host's immune system weakens, through disease, aging, or the use of immunosuppressants, the bradyzoites reactivate, but the unsolvable paradox is not there. The problem lies in the fact that the most aggressive treatment available for cerebral toxoplasmosis in immunocompromised patients, high doses of pyrimethamine combined with folinic acid to mitigate toxicity, collaterally suppresses dopamine production. In HIV and cerebral toxoplasmosis patients treated with this protocol, studies have documented severe depressive syndrome in 34% of cases, beginning between the 2nd and 4th week of treatment. The instinct to treat has created a new wound in the same organ. You go in with a parasite that raises dopamine and dulls fear. You treat it. And you come out with a suppressed dopaminergic system, a set of cysts that the medication didn't touch, and a risk of clinical depression that didn't exist before treatment began. The solution doesn't solve the problem. It replaces it with another, less visible, more silent, and equally without a cure available. What science has learned from Flegger, from Torrey, from Rikansky, and from the dozens of researchers who have spent entire careers trying to convince colleagues that a cat parasite deserved serious clinical attention is this: human cognition is not a closed structure. It is permeable. And there are organisms that have evolved specifically to exploit this permeability. What the victims never received was a diagnosis. Because the test is not routinely ordered. Because the symptoms, when they exist, are confused with personality traits, because a general practitioner has no protocol to look at an impulsive, distrustful, and accident-prone patient and think, what if it's not who he is, but what's inside him? 2 billion people. 0 universal screening. 0 treatment for the chronic phase. Zero cure for the cysts. Science named the predator. Then filed the report away. The difference between a Toxoplasma gondii infection that remains latent and harmless for the rest of your life and one that reactivates and produces measurable neurological damage is not access to expensive medical technology or a rare specialist. It is basic immune maintenance, which anyone can perform without a prescription and without extraordinary resources. First, know your status. The IgG and IgM serological test for toxoplasmosis costs between 20 and 80 reais in any clinical analysis laboratory and can be requested by any general practitioner. If you have a domestic cat, frequently consume beef or pork, or garden in soil that may come into contact with feline feces, the test should be part of your annual checkup. It isn't because nobody asked for it, and nobody asked for it because the health system has no protocol for something that, in most cases, does not produce immediate symptoms. Second, if you are seropositive for toxoplasmosis, the only variable you control is the robustness of your immune system. Latent intracellular parasite means that the only biological brake available is your innate immunity. Consistent sleep, control of chronic inflammation, and monitoring of conditions that require immunosuppression are, in the absence of curative treatment, the only tools that science has today to keep the cysts dormant. And third, the most disturbing of all, if you have been making choices that seem impulsive, if your perception of risk seems dulled, if you recognize yourself in something described in this video, there is a real statistical probability that some of it is not temperament. Be it character. Be it weakness. Be it a parasite performing the only function for which it was built, to survive inside you, at your expense, without you knowing. But Toxoplasma isn't the only organism that has learned to use your nervous system as a host. In the next video, the gut bacteria that's producing your neurotransmitters, and what happens to your anxiety, your depression, and your ability to feel pleasure when it starts to die. The process is called dysbiosis. What it does to your brain doesn't yet have a name in classical psychiatry. But the data does.